Hey everyone, Dr. Shook here. Today I want to share with you a really important topic, and this is how urinary tract infections could contribute to and be a trigger of rheumatoid arthritis. Now, the way that this occurs is the common urinary tract infection is caused by a bacteria called Proteus mirabilis. Now, the way that it can induce rheumatoid arthritis is when your immune system reacts to Proteus mirabilis, this bacteria, it will recognize it as foreign and it will start making antibodies against the Proteus mirabilis. Now, an antibody is kind of like a tag, and the way it works is when the immune system sees the bacteria, it will make these antibodies that are designed to stick uniquely to that bacteria, and they stick to it based on the protein structure of the bacteria itself. So the bacteria has protein within it, and it has a specific shape and a specific sequence of amino acids, which are the building blocks of proteins. The antibody sticks directly to that sequence of amino acids and the shape of that protein, how it's folded. Now, in some people, that antibody that sticks to the Proteus mirabilis protein can also stick to their joint, the proteins of their joints. And when this occurs, the antibody is actually tagging it, and the immune system thinks that whatever is tagged is foreign. So then it starts reacting against that tagged tissue, and you start developing that's when the autoimmune process essentially begins against the tissues. This is due to a process called molecular mimicry. Now, molecular mimicry is an immunological term, and it's where the proteins in the body are similar to the proteins in something foreign, and through this process of cross-reactivity where an antibody can bind to both things, that the autoimmune process can begin. So a few things to keep in mind here. If you are dealing with rheumatoid arthritis, you absolutely need to be screened for these pathogens. So talk to your doctor about it. They need to consider Epstein-Barr virus, because that's also a trigger we've talked about in other videos. They need to consider P. gingivalis, the bacteria that causes gum disease and your gums to bleed, because that's also a trigger through similar types of immunological mechanisms. But you definitely want to talk to your doctor. If you need help with any of this, I help and I work with people around the world to investigate these triggers, put together dietary, lifestyle, and supplementation strategies to help with addressing the triggers and drivers of the autoimmune process. We do this through functional medicine, and in particular through functional immunology. And I look at these cases through a lens or a model called the environmentally induced model of autoimmunity. If you have questions, don't hesitate, reach out, let me know. I'll do my best to help you. Hope you have a